Welcome back to the channel, everybody.
Oh, welcome back. We talking about drug allergies.
Yeah, so this is kind of like a definitions and stuff. Pretty basic ideas you need to know for your Naplex. Hope everyone's doing good today, or whenever this video goes live. So let's get into this topic. There's different types of drug allergies. There's type A, which is dose dependent, which is also the most common type of allergy. There's something most common, that's probably gonna be a question, be like, what's the most common type of allergy? And yes, you know it's type A. Type B allergy is influenced by patient specific factors such as allergies, intolerance, and idiosyncratic reactions, which is basically a reaction that no one knows why it happened. So there's type 1, which is within like 15 to 20 minutes, type 2, which can happen from minutes to hours, type 3, which is 3 to 10 hours, and type 4, which is 40 hours or several weeks. They could just ask you, like, hey, this reaction happened within 15 to 20 minutes. What type of reaction is this? These are just simple questions that all it is definitions, so why not know it? You know? It's like on the MCAT, like if they ask you something like this, that's just a definition, you're like, I need to know that because that's just easy points. This entire chapter in the RX prep book is just easy points if you ask anything from it. So those are some important terms you guys should be aware of, and for future videos, I'll refer to as certain terms. So a black box warning, or otherwise abbreviated as a BBW, is a risk of a disability, permanent or death. So it's just usually probably the most severe side effect from the drug and what you need to make sure you make patients aware of. Adverse drug event, or after this video is going to be referred as ADE, is basically a undesirable or uncomfortable or dangerous effect from the medication. An Alejandro scale, this is basically used to see what's the likelihood of a drug actually caused the ADE. Honestly, before studying this chapter, I'd never heard of Alejandro scale before. I don't know if this was actually taught in pharmacy school or not. So I don't know how important this actually is to know for your Naplex. The MedWatch is important to know. This is where you actually report adverse drug events to. And this is kind of where, like, during phase 4 trials, is where a lot of people report the side effects to. So then they get kind of a further idea, like, what are the side effects of this medication? What's, like, the likelihood of the occurring? Because trials are only, like, maybe 20,000 people or so. Then once you release the drug to the public, now you're getting millions of people taking the drug, which is like the phase 4 trials after its release. So reporting side effects to MedWatch is really important. So, but a common misconception is like a stomach ache or nausea from a drug. People think that's an allergy. This is actually called an intolerance. A common example of this is someone says they have a penicillin allergy. So what we do in the pharmacy is ask them, like, hey, what was the side effect? What was the actual side effect from your penicillin? A lot of people say stomach upset. That's not an allergy, that's just an intolerance. One of the most common side effects from antibiotics is stomach upset and nausea. So it's just actually a side effect from the medication. But if someone says your lips swelled up, they have hives all over their body, that's more of a allergy to the medication. So just something to clear up with you guys. Anaphylaxis treatment, epi and Benadryl, diphenhydramine, plus steroids, plus fluids. And epi is usually 1 milligram per ml as a dose, and it's usually zero point 0.3 milligrams for an adult and 0.15 for pediatrics. So, just random facts. Again, that's pretty much all this chapter is, so I'm kind of flying through it. And some common allergies for you guys. So, a beta lactam allergy, you see this on your test. Avoid all classes for beta lactams. In reality, beta lactams, if you're in a beta lactam, like penicillin versus cephalosporin, in practice, they might try to use a cephalosporin because there's less than like 10% less than 10% reactivity, cross reactivity between the classes. But on your exam, avoid it. Sulfa, always avoid it. Some examples are thiazides, loop diuretics, acetazolamide, zonisamide, Celebrex, and darnavir. So if you see a sulfa allergy, avoid any of these drugs. These are probably the most common ones you'll see. peanuts and soy, clevipine, propofol, progesterone. Progesterone is an interesting one for peanuts and soy allergy. You wouldn't really think of that. I know I wouldn't if I wasn't studying this chapter. Eggs, again, avoid clevipine and propofol. Also avoid the yellow fever vaccine too. So, any questions about that, Mitchell? Concerns?
No,
No? Yeah.
I'm learning a lot because like this is a lot of. I mean, a lot of stuff is a little familiar, but a lot of it is like, whoa, what the hell?
Yeah, I mean, if you look at it for like one or two times through, like if you guys just watch the video on 2 times speed, like 2 times or so, you'll know all that stuff. It's pretty basic stuff. The only thing that might be hard in this chapter to learn is the sulfa allergies. So remembering zonisamide, which is kind of a weird drug, but knowing that's actually a sulfa allergy. Acetazolamide, which is used for like I guess like heights, something like that. Like knowing that's to the sulfa allergy. Celebrex. You don't think of these sides and loops you think of, but this is probably the only hard part of this chapter. Is this like last slide? So I hope you guys learned something. But if you are confused on anything, just comment below down below, and we'll try to clarify on stuff. Peace.